Well, we were getting ready for my grandson's birthday party, and I was right outside on the back deck trying to surprise him with his sister's help with me, of course. Blowing up the pool. I was blowing it up like this. I felt myself getting weak, and the next thing I knew, I was down on the ground right here.
And I apparently told my husband that day, May 4th, I told him that night, I said, I have a really horrible headache. I can barely see, my head hurts so bad. And so he had to go to work, but he called my cell phone apparently about an hour later to check on me, and I didn't answer. They went in my house and found me on the floor, passed out. And my kids were in their cribs, just playing together, just no one was home.
Denise Moss and Stephen Owens had suffered different kinds of strokes.
And strokes really come in two main varieties, if you will. There are ischemic strokes where there's lack of blood flow to the brain, and then there are hemorrhagic strokes where there's either bleeding in the brain or around the brain.
Healthcare providers emphasize the need for medical treatment at the first sign of a stroke. They use the phrase, time is brain.
If you can imagine a stroke as sort of like the brain holding its breath, it can't hold its breath for very long. So the faster a patient presents for treatment, the more likely it is that that patient will have a good outcome.
Stephen Owens didn't want his family to call 911, but his 11-year-old granddaughter, Angelina, insisted.
Because his arm was turned that way.
She showed me this one and said, your mouth was...
Paramedics rushed him to the hospital where he was treated for an ischemic stroke by a team from the UW-Medicine Neurosciences Institute Comprehensive Stroke Center.
And the treatments for ischemic stroke is a shot of a medicine called TPA, tissue plasminogen activator, which is a thrombolytic that dissolves blood clots. And that medicine has to be given within 4.5 hours at the latest.
And then after that, they scheduled me to go in for the surgery. And once they went in with the surgery and stuff and pulled the blood clot out.
And that's where a small catheter is weaved into the blood vessel and the blockage, and then the blockage is pulled out. The blood clot is actually pulled out of the blood vessel.
The procedure was performed in a state-of-the-art operating room called the Angio Suite.
This Angio Suite is really the cutting edge. This is the sharpest knife in our toolbox in terms of the cutting edge neurosurgical care that we can deliver for endovascular using these very precise tools in order to get to where we need to go.
Denise Moss suffered another type of stroke, a hemorrhagic stroke. UW-Medicine Neurosciences Institute neurosurgeon Louis Kim performed a 12-hour procedure.
Denise suffered from a ruptured AVM, that stands for arteriovenous malformation. It's an abnormal tangle of arteries and veins in the brain. In Denise's case, what brought her to care was that her AVM had ruptured, causing a bleeding kind of a stroke that necessitated urgent care.
Waking up in the rehab section, and my husband, handing me a mirror and me saying, "Can I see the back of my head?" Oh my gosh, and I just went through all of that. What happened to me?
That's my angel, baby.
Denise Moss and Stephen Owens are grateful for their quick-thinking families.
If I would have waited 2 more minutes, my whole side probably would have been paralyzed and I wouldn't be able to talk.
And they're grateful for the care they received from the entire team, physicians, nurses, techs, and therapists at the Neurosciences Institute.
If it wasn't for them, I wouldn't be here sitting talking to you now.
I told Dr. Kim when I left the rehab, I said, I'm always going to send you a Christmas card. You have to see my kids getting older.
I get a Christmas card from Denise and her family every year, and it's wonderful to see her husband, and her 2 daughters looking and doing so well. And we're just so grateful that we're able to participate in her care.
I think about it every day just because I won't ever forget. I look in the mirror and I think about it every day, but in a good way. I think about it how life is short and I don't take anything for granted.